Hi, my name is Jessica Bellows, and today I'll be talking about coercive paraphilias, origins and treatments for specific sexual variations. What is coercive paraphilia? It is an uncommon sexual expression displayed by a minority in society. It is not the same as a sexual fetish, but a possible resulting mental health disorder of a fetish. However, referring to various paraphilias as a disorder is controversial because there has been no agreed upon line between what is acceptable and unacceptable paraphilia. Today I'll be discussing zoophilia, voyeurism, exhibitionism, and telephone scatologia. Zoophilia is defined as an erotic fixation on animals that may result in sexual excitement through real or fantasized contact. Often incorrectly referred to as bestiality because zoophilia is often believed to refer to a more emotional, less sexual relationship. It is not necessarily outlawed itself, but is considered a form of animal abuse. Zoophilia believed to contain all three interrelated aspects of sexual orientation: affectional, sexual, and erotic. A majority of participants in case studies admitted to having deep feelings of affection, fantasies, and sexual attraction towards their animals. Participants also proclaimed happiness and an unwillingness to end their sexual relationship with them. Influencing causes of zoophilia are believed to include availability of animals, relative isolation from other people, and personality types of those in rural areas. Possible treatments for zoophilia have not been provided or proven effective. Some believe it is a mental health disorder and may be treated by drug regimens, cognitive therapy, and aversion therapy. Voyeurism is defined as one obtains sexual gratification from observing unsuspecting individuals who are partly undressed, naked, or engaged in sexual acts. Voyeurs observe either from a distance or by stealth by utilizing peepholes, two-way mirrors, hidden cameras, and other various devices and strategies. Believed to be closely connected to sadism, deriving pleasure from pain by creating an active or dominant and passive or submissive component. Voyeurism is more common in men but does occasionally occur in women. However, the prevalence of voyeurism is not known. Diagnosis is made only when this is a preferred and exclusive means of sexual gratification. It is specifically labeled in the American Psychiatric Association's Diagnostic and Statistical Manual as a paraphilic disorder, thus classifying it as a health issue similar to obsessive-compulsive disorder. When treated as OCD, success of decreasing voyeuristic behaviors has been recorded. Another treatment said to aid in satisfying voyeuristic desire is exposure to pornographic material. Woohoo! Yay for porno solutions. Exhibitionism is a perversion in which sexual gratification is obtained from the indecent exposure of one's genitals. Often referred to by specific actions performed by the exhibitionists such as flashing, mooning, streaking, and possible telephone scatologia, which I'll be discussing later on. Statistics of those participating in exhibitionism are difficult to obtain since it is believed to be seldom reported and is viewed more as a nuisance than serious criminal justice matter, however believed to account for up to 2/3 of all sexual offenses. In recent years, some have argued technology, namely the increased access to picture and video capturing technology, has led to a phenomenon known as empowering exhibitionism. Exhibitionism is usually treated with a combination of psychotherapy, medications, and surgical castrations for the more serious offenders like violent rapists. Telephone scatologia is defined as an unsolicited telephone call where a person derives sexual pleasure by using sexual or foul language to an unknown person, often reported by the recipient as a form of sexual harassment or stalking, and is considered a Class A misdemeanor, especially in California. Originally seen as a less threatening paraphilia than others, but recently studies have shown that those who partake in telephone scatologia often do so in addition to other paraphilias, most commonly exhibitionism and voyeurism. Each of these paraphilias is an attempt to provoke others while non-required physical contact, often seen to be more aggressive and more distinct than voyeurism and exhibitionism. Fantasy plays a large role, part due to callers' inability to see the recipient while experiencing intimacy from the phone call. Treatment options may include psychotherapy, individual psychotherapy, group therapy, and family therapy, as well as pharmaceutical therapy. For all paraphilia diseases, treatment is difficult because many patients don't seek out help to begin with. This is my works cited. Thank you for watching. I hope you learned something. Bye!